Welcome back. We are just a few days away from February, and February is Heart Awareness Month. It's one of the most important health observance months because of the heart's impact on the body. Joining us this morning to help get you heart healthy is Baptist health cardiologist Dr. Scott Davis. Good morning, Dr. Davis.
Good morning. How are you?
Pretty good. I hadn't seen you since church.
Yes,
and
right. Christmas.
He cleans up pretty nice.
I don't walk around in scrubs all the time.
Yes, sir. Yes,
That's
sir.
Right.
So, Dr. Davis, what is a calcium score?
Right. So we have a package, and it's a screening tool. Okay. So if you have a heart doctor, if you've had bypass surgery, if you've had stents, this message is not for you. This is for folks that are concerned about their heart risk. And there is a test that we offer at Baptist through a Be Heart Healthy campaign, our Be Heart Healthy campaign, called a calcium score. Okay. And it's looking at calcium involving the heart arteries. Remember, we talked about the heart being the same size as your fist, 3 pipes supply gas to the motor. And so we're looking at calcium, or like I tell patients, rust on the outside of the pipe. Well, how's it work? I'm your plumber. I come over to your house one day and I look under your kitchen sink at the drain of your kitchen sink. And I start noticing, you know what? There's been some rust accumulation on the outside of the pipe, and that may indicate gunk on the inside of the pipe. A calcium score tells us, are you starting to get calcium plaque on the outside of the pipe? And it may need more further evaluation, such as a stress test. Changing, adding a cholesterol medicine to your regimen. And so it's designed to identify people that might be at risk and then get them plugged in to see somebody like me on the cardiology side. So we tell patients, or tell folks, look, the value here is if you're kind of in an intermediate risk category. You're like, Dad had a heart attack at 52. I'm looking at 50 next year. Maybe I need to get plugged in. If you're the 25-year-old CrossFit instructor, the yield from this is going to be so low, it's probably not going to help you. If you're 65 and a 2-pack-a-day smoker, diabetic, you need to go see a heart doctor regardless of this. You see what I'm saying? So it's designed for intermediate risk concerned folks that have not gotten plugged in to see a cardiologist to get a little better evaluation and some screening.
Are there certain age groups or other risk factors?
No. I mean, when we look at, heart disease does not discriminate, right? Okay. And so it can happen across all age groups. But we look at folks, if you've got a family history, if you are diabetic, if you have high blood pressure, if you're dealing with weight issues, any of these risk factors need to be identified. So talk to your family doctor or give us a call at 1-800-BAPTIST. We can get you set up with a heart health screening. Dr.
Davis, thank you so much for your time. I love the way you explained it as a plumber, and I started thinking about the piping, and I visualized it all.
You'll play with it in your head today.
Yes, sir. Yes, sir.